Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about adrenal insufficiency, unraveling a hidden diagnosis. What is adrenal insufficiency? It's a syndrome caused by a deficiency of cortisol, a vital hormone produced by the adrenal glands. It's a spectrum ranging from mild symptoms to a severe, life-threatening emergency called an adrenal crisis. There are three main types: primary adrenal insufficiency, or Addison's disease. The adrenal glands themselves are damaged and can't produce enough hormones. This is rare. Secondary adrenal insufficiency. The pituitary gland, which controls the adrenals, isn't producing enough of the stimulating hormone ACTH. This is also rare. Glucocorticoid-induced adrenal insufficiency, the most common type, caused by long-term use of high-dose steroid medications which suppress the body's natural hormone production. The adrenal gland and hormone production. The adrenal glands sit on top of the kidneys. The adrenal cortex produces vital hormones. Cortisol, a glucocorticoid, regulates metabolism, blood pressure, and immune response. Aldosterone, a mineralocorticoid, regulates sodium and potassium, essential for blood pressure. Androgens like DHEA, which are sex hormones. In primary adrenal insufficiency, the adrenal cortex is damaged, leading to a deficiency of all of these hormones. In secondary and glucocorticoid-induced adrenal insufficiency, only cortisol and androgens are deficient, as aldosterone production is regulated differently. Clinical presentation, the symptoms. Symptoms of adrenal insufficiency are often non-specific, which can lead to a delayed diagnosis. Common symptoms, all types: fatigue, 50 to 95% of patients; nausea and vomiting, 20 to 62% of patients; anorexia and weight loss, 43 to 73% of patients. Unique to primary adrenal insufficiency: hyperpigmentation, 74% due to high ACTH levels; salt cravings, 12 to 19%, and low blood pressure due to aldosterone deficiency. Symptoms of glucocorticoid-induced adrenal insufficiency often appear after tapering or discontinuing steroids. Adrenal crisis, a medical emergency. An adrenal crisis is a life-threatening state of severe cortisol deficiency. It's often triggered by a major stressor like illness, surgery, or injury, where the body's need for cortisol skyrockets. Signs of a crisis: severe low blood pressure, altered mental status or unconsciousness, severe nausea, vomiting, or abdominal pain. Emergency treatment: immediate injection of high-dose hydrocortisone, 100 milligrams intramuscularly or intravenously. Medical ID bracelet is essential. Patients must be taught how to administer their own emergency injection. Indications for testing include unexplained symptoms. Patients with a combination of symptoms like unexplained fatigue, nausea, vomiting, weight loss, abdominal pain, fever, or low blood pressure should be tested. Hyperpigmentation, the presence of hyperpigmentation, darkening of the skin, especially in areas like skin creases, scars, and gums, is a strong indicator of primary adrenal insufficiency. Salt craving. A craving for salt can be a sign of mineralocorticoid deficiency, which is often seen in primary adrenal insufficiency. Hypoglycemia. In children, unexplained low blood sugar can be a significant sign. Adrenal crisis. Patients presenting with a life-threatening state of shock that is out of proportion to their illness, along with confusion, lethargy, and dehydration, should be tested for an adrenal crisis and treated immediately. Predisposing factors, individuals with certain conditions or who are taking specific medications are at higher risk. These include people with autoimmune diseases such as type 1 diabetes or autoimmune thyroid diseases, infections such as tuberculosis or HIV, or those who have been on long-term glucocorticoid therapy. Pregnancy. Pregnant women with unexplained persistent fatigue, nausea, and low blood pressure should also be tested. Diagnosis, the lab work. Diagnosis involves a combination of clinical suspicion and lab tests. Initial testing and early morning around 8 a.m. blood draw is the first step. Serum cortisol levels less than 5 micrograms per deciliter are highly suggestive of adrenal insufficiency. Levels over 10 make adrenal insufficiency very unlikely. Corticotrophin, ACTH, high levels indicate primary adrenal insufficiency. The pituitary gland is trying to stimulate a non-responsive adrenal gland. Low levels indicate secondary or glucocorticoid-induced adrenal insufficiency. DHEA, low levels support the diagnosis of adrenal insufficiency, as its production is also dependent on ACTH. And dynamic testing for patients with inconclusive cortisol levels, 5 to 10 micrograms per deciliter, a corticotrophin stimulation test can be used to assess adrenal function. Treatment. The goal is replacement. The primary treatment for adrenal insufficiency is to replace the deficient hormones. Glucocorticoid replacement, hydrocortisone, a short-acting steroid typically dosed in 2 to 3 divided doses to mimic the body's natural cortisol rhythm. For example, 15 to 25 milligrams daily. Prednisolone, a longer-acting steroid often taken once daily. For example, 3 to 5 milligrams daily. Mineralocorticoid replacement. Fludrocortisone, required for patients with primary adrenal insufficiency to replace aldosterone. This helps maintain blood pressure and electrolyte balance. Androgen replacement, DHEA, may be considered for women with low libido or fatigue, but the overall benefit is small. Patient education and management. Patient education is crucial for preventing adrenal crisis. Stress dosing. Patients must learn to increase their glucocorticoid dose during times of illness or physical stress. For example, for minor stress, fever, bed rest, the daily dose of hydrocortisone is doubled or tripled. For major stress, surgery, severe illness, a high-dose injectable steroid is required. Long-term monitoring. Regular follow-up is necessary to monitor symptoms, adjust medication doses, and address any changes in health. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you.